I'd like to introduce you to our incredible panelists today, Johanni Cardenas and Irfan Patel. Both of these advocates are NORDVER Action State ambassadors and have made incredible contributions to the rare disease community. So let's get started. Irfan, let's start with you. Can you please share a little bit more about yourself and where you're joining us from today and how you got involved in rare disease advocacy?
Yeah, thank you, Rose. As Rose said, my name is Irfan Patel. I'm the RAN ambassador for the state of Delaware. Myself and my wife were blessed with 4 kids, and 2 of my 4 kids have been diagnosed with a rare metabolic condition called methylmalonic acidemia, MMA mutation 0. And so when my son was born back in 2001, November of 2001, at that time, we did not have MMA as part of a newborn screening in the state of Delaware. And the way he was diagnosed was a very traumatic experience. So he was diagnosed at 9 months of age, and he had to go through a very severe metabolic crisis to get to the diagnosis. And then as we were raising him, we went through multiple challenges. Obviously, the diagnosis was a good thing, but then there were a lot of unknowns. We did not have. We wish we had a playbook to follow. Right, it's a rare condition. Access to treatment, access to medical care, medical food, all those challenges came in, really weighed in on us. And then 7, 8 years fast forward, our third child, Khatija, she was born with the same condition, but by that time we had added MMA as part of the newborn screening in the state of Delaware. So as we were going through these challenges, I didn't realize that there is huge lack of awareness in terms of these rare conditions. And especially even if you look up to your primary care, right? In most of the cases, I'm sure many of you can attest to this, right? Even the primary care is not aware of all the challenges, so you end up being the advocate. And then if you take that whole thing into context, I realize there is a need for raising awareness on these rare conditions. Not only within the medical fraternity, but also in terms of your education system, in terms of your care. I mean, outside the school. So there are many challenges, and we realize raising awareness is the first step that we have to embark on. And then to add to this. 5 years ago, I was also diagnosed as having another rare condition called combined melanic and methylmalonic acidemia, CMAMA. And again, as per NIH, there are only 12 documented cases of CMAMA all over the world. Again, there are a lot of unknowns. We don't know what the prognosis looks like. So in a nutshell, all these challenges, the only way we can address all these challenges is by raising awareness, by coming together. As you say, alone we are rare, together we are stronger.
Yeah, that's great. Thanks, Irfan, for sharing your story and your family's story. You certainly bring a lot to the table. Johanni, can we turn it over to you for a second? Can you share a little bit more about your background and how you found your way into rare disease advocacy?
Absolutely. As Rose mentioned, I'm Johanni Cardenas, and I am the state of Florida ambassador for the Rare Action Network. Super humbled to be able to serve in this space. In 2015, my second child, my son, he was 6 at the time, almost 7, was diagnosed with adrenal leukodystrophy. It really came as a surprise, as many times with these diagnoses, because I started looking for perhaps ADD, ADHD, just based on feedback that I was receiving from his teachers about his behavior and his lack of almost becoming lethargic. And so I thought, well, maybe there's something else. The interesting part about that is that I recall at the age of 3, and as I went to doctor's visit, similar to what Irfan mentioned, I brought some concerns that I had, but they weren't necessarily addressed at the time. But through that process, visited an endocrinologist, and they gave us the diagnosis for adrenal leukodystrophy in 2015. And we were blessed in the sense that we were able to find care for him quickly and connected with a medical team in Minneapolis, and he received gene therapy, and it worked really well for a while. And unfortunately, he did pass away in 2016, just short of 18 months from diagnosis. He lost his battle, but one of the things that at that time when I got the diagnosis, I had searched and found a lot of information on Nord's site, and so I always kept going back to Nord's information and the documents that were written. And I knew I wanted to do something, of course, and did as best as I could. At the time, there was a lot of work being done around newborn screening. And I remember being in the hospital and sort of connecting with people and saying, hey, we've got to do this. I know the importance of this. And so did what I could from afar, and knew I wanted to do more as he got better. That was the hope. But even after he passed, really wanted to make sure that I'm impacting the community as best as I can, and finding all of those questions that I had, and guidance that I sort of felt like just I didn't have doctors. They didn't know what this was. So education and awareness. And interestingly enough, through that process as well, my sister was undergoing some of her own issues that we were trying to find what was wrong. And recently, she was diagnosed as well with two rare disorders, dystonia as well as stiff person syndrome. So definitely has been a journey through rare diseases. I was sort of pushed into it right when my son was first diagnosed, but excited to do what I can.
Yeah, thank you both for sharing, your background and how you came to the rare disease advocacy table. I think, with my experience in the community, everyone comes to the table in a different way. And the fact that, you both have been able to turn your rare disease fights into advocacy is just really admirable. And we really appreciate all that you do. I'd like to take a second to highlight some of the key policy issues that you just discussed, and how you've advocated for them, and why they matter to the rare disease community. So first, Irfan, with you, can you share a little bit about the importance of medical nutrition for your family, and what you've been working on in the state of Delaware?
Yeah, sure, Rose. Again, I took the formal definition of medical nutrition, right? I'm sure it will sound like a preaching to the choir here, but if you look at medical nutrition definition, right, under the Federal Food, Drug, and Cosmetic Act, it's a food which is formulated to be consumed or administered enterally under the supervision of a physician, and which is intended for the specific dietary management of a disease or condition for which distinctive nutritional requirements based on recognized scientific principles are established by medical evaluation. Now, coming to layman's terms, right? Many of these rare disease patients, right, including my kids, they, in the absence of a treatment, in the absence of a cure for the rare condition, these metabolic formulas, right, this medical food is one of the viable sort of management way to manage their condition. And yet, there is a huge challenge uh, in terms of coverage, insurance coverage, because these medical formula can be quite expensive. You can imagine with two of my kids, the medical formula the cost of the medical formula runs into a couple of $1,000 a month, right? And then I still remember, like, we used to start them on Pro-Free, Propimix 1, Propimix 2, Duocal. I mean, I'm sure I'm forgetting some of the names of the formula here. So the bottom line is these formulas are very expensive. And then obviously, if you look at the insurance coverage, the insurance coverage is not very consistent across the 50 states of the US. And then just to give you a flavor, if you look at thanks to Nord, when Nord published the state report card for state of Delaware, we are ranking C in terms of medical nutrition coverage, right? Not a good place to be, right? We would like to be at least B or A in terms of coverage. So that's one area where I'm really working with the state lawmakers to make sure that we improve in terms of medical coverage in the state of Delaware. Like I said, medical nutrition is the only viable treatment option that's left for these rare disease patients. And then the second area where I'm working on is establishing RDAC, right? As you see, Delaware is one of the states where we do not have a RDAC yet, but thankfully in our rare disease uh, day last February, I had invited the lieutenant governor, and she's helping me work with the lawmakers to introduce a bill to establish RDAC in the state of Delaware. Again, Johanni, I'm going to reach out to you to get more information and more support on that.
Absolutely.
That's great, Irfan. Thanks for sharing that. Yeah, medical nutrition and rare disease advisory councils are two issues of strong importance in our community. Johanni, I'd love to turn it over to you for a second to talk about your experience on working on a rare disease advisory council in Florida this year and what this means for the rare disease community in your state.
We're so excited, Rose. This has been something that, as Rare Action Network, we sort of started working a few years back, and it took a little while, right? And we thought that COVID was sort of hindering a little bit of our work because it happened, but through persistence and just being able to adapt with what was going on, we were actually able to make some strides in connecting with our senator who sponsored our bill, Senator Baxley, and then subsequently finding our House representative as well. But it's been a really exciting project, really a focus to work on for Florida. This is really going to impact everyone in our state that's living with a rare disorder, right? Because the purpose of the RDAC is to work alongside the legislation to say, what are the decisions that you're making? How are these things impacting all of those living with a rare disorder in our state? So I am hopeful, and I am excited to be able to get to work and bring some clarity, some awareness, education, and most importantly, I think that support and impact that we need for all people with rare disorders. Needless to say, of course, right? Alone we are rare, together we are strong, and that's the strength that we can build within our community.
Yeah, that's definitely true. I mean, I think to take a step back for a second too, for folks who are joining us today, who are new to this concept of a rare disease advisory council, NORD has been working on rare disease advisory councils over the last, several years here, and we can drop a link in the chat that explains more about what an RDAC is and the project that we started formally at the end of last year to help states like Florida enact really strong rare disease advisory council legislation. At this time, more than 17 states have enacted rare disease advisory council legislation, and all that means is that we worked on a law to help create a state-based rare disease advisory council that will include different members from throughout the rare disease community. So everyone from a patient, a caregiver, a provider, researchers, health department officials. I could go on. It brings everyone to one table to talk about the pressing issues and to make recommendations to state government. I think one of the misconceptions in rare disease advocacy is that sometimes, there's only federal work to be done, but Johanni and Irfan are great examples of there's a lot of work to be done at the state level too, and rare disease advisory councils are just one aspect that you can work on in your state. So if you're interested in learning more about what an RDAC is, would encourage you to check it out, and we have a map on our website that explains if an RDAC is in your state or not, and how you can get more involved. Well, thanks, Johanni, for sharing that. I'd like to now transition to talk about another issue of importance that both of you have touched on today, which is newborn screening. Can you share a little bit about why that's important for your disease community and what you're working on at the state and federal level on this?
So,
sorry, Johanni, go ahead.
Yeah, needless to say, newborn screening is so important, right? I know for my son's condition, adrenal leukodystrophy, early diagnosis, and for many others, of course, early diagnosis is so important. I had the opportunity in Florida. Adrenal leukodystrophy was added to the screening panel for children, and that was part of the work that was being done as well during the time that actually my son got diagnosed, and had an opportunity to really attend those meetings and In 2019 is when newborns started to get tested here in Florida. And so that is huge and it's significant. Early diagnosis gives us the treatment. There is no cure, but families can be better informed without, I think, any surprises.
Yeah, definitely. That's good background. Irfan, do you have anything else to add on what you've been working on newborn screening?
Yeah, definitely. I mean, I echo what Johanni mentioned, right? I mean, simply put,
Yeah.
newborn screening saves lives. Again, going back
Mhm.
to my family's case, uh, when our son was born in 2001, like I said, MMA was not part of the newborn screening, so obviously we missed it.
Mhm.
So until 9 months of age, and the way he was diagnosed was very traumatic, right? I mean, we were on an aeroplane flying back from India to the back to the States after spending time with the family. He got into metabolic crisis. We had to make an emergency landing in Turkey. We were there for 3 weeks. So anyway, long story short,
Wow.
we need not have to go through that trauma if newborn screening had captured that at birth. And again, not to mention, right, the every metabolic crisis leaves behind a permanent, irreversible damage, right? So the idea here is to
Mhm.
treat early, to diagnose
Mhm.
early, and that will also help in terms of the quality of life of these patients, right? And again, there have been many statistics that also points to the fact that early diagnosis also lessens the burden on the healthcare system as well, right? Now that you're well equipped, you know what the condition is, you know how to treat, how to take care of that. And like I said, in Delaware, that's a gap, but we're working on it. We have added many conditions to the newborn screening. And again, I was looking at one of the CDC statistics. I think that there are about like of the 4 million newborns, new births every year. There is about 12,000 that get diagnosed with some sort of
Mhm.
disorder. And I think that's capturing those at birth is very important.
Mhm.
Yeah, absolutely. Yeah, newborn screening is really important to our community, and it's an issue that NORD, advocates for every day. And both of you guys have done a really great job providing some background on, and how it applies to your family's experience. But I also wanted to flag for folks, if this is a new issue for you and you want to learn more about newborn screening or some of the other issues that we started to talk about, like medical nutrition and the Rare Disease Advisory Council work. NORD puts out a state policy report card every year that is a snapshot of where states are and how they're doing in terms of rare disease policy. And so we'll drop a link in the chat that you can check out and see how your state measures up. But it's a really good backgrounder on the issues and a great way to check out how your state is doing in comparison to others. So now I'd like to spend a few minutes to talk about today's times. We're living in, a different time of advocacy with COVID. Like Johanni, like you mentioned earlier, it certainly impacted, how you advocated this year for the Rare Disease Advisory Council. And in some ways, like you said, you were surprised. It made it maybe easier. So I want to spend a few minutes, going over that and how that's, impacted all of us. So Irfan, let's start with you. Can you talk a little bit about how COVID-19 has impacted your advocacy efforts this year, and are you doing anything differently to get through to your state and federal lawmakers?
Yeah, yeah, definitely, Rose. I mean, as Johanni mentioned, right? Initially, last year when the pandemic started, we were concerned about the impact on our advocacy efforts, right, and the
Right.
campaigns. But I mean, it turned out to be a great opportunity as well, right? So, for just one example, in a typical normal world, we would go to the state house to introduce the concurrent resolution to select to recognize Rare Disease Day, and we
Mhm.
couldn't do it last year and this year. But then, since last year it was beginning of the pandemic, I mean, nobody was prepared to address that. But this year we were able to do everything virtually, and the response was tremendous, right? I mean, when we did
Right.
these programs in person, we would have about like maybe like a dozen patient and caregivers with us, and then we would not be able to meet all the lawmakers. But now we're able to get a broader audience, and then some of the lawmakers who couldn't join us, we made them record their message, right? So this virtual world has really opened up a lot of opportunities for us. The only area that I feel that got slightly impacted was we'd also normally do a lot of advocacy in the educational system, right? In the schools and other civic based organizations. I think that took some slight hit, but then I would say the net result would be, I would score that as a positive, right? We were able to, the outreach was more this year compared to pre-pandemic days.
Yeah, no, I think those are all great points. I think that's definitely something that we saw across the Rare Action Network this year for Rare Disease Day was that, we had great attendance and were able to celebrate virtually, and maybe, folks who maybe weren't able to typically travel to the state capitol were able to join us. So it was a really great way to celebrate the day this year. So thanks for sharing that. Johanni, can you talk a little bit about how it's impacted, COVID-19 has impacted, your advocacy efforts this year, and anything that you worked on differently to advance the Rare Disease Advisory Council bill?
Yeah, similar, we were sort of pushed into it, and it actually
Right.
was a net positive because we, not only from an advocacy standpoint, I think we were able to include a lot of individuals that couldn't maybe attend. Florida is a really large state, so that was typically a challenge for us because to go to our state capital easily for most people, it's an 4 hours a day event. For the majority of Floridians, it's not a short drive or commute, right? So it gave us the opportunity to include individuals that maybe couldn't make it because of distance or whatever other things were in the way. But I think it also highlighted the gaps that exist within our healthcare system. I think it shed a little bit more light just in general, not even thinking about the rare disease community. So then therefore more impactful for the rare disease community. So I think all in all, even though it was probably challenging, we all had to get used to the virtuals. It truly has opened the doors for more because we're able to do more meetings with our elected officials since there's no drive time, but it also helped us to highlight and shed more light on the true gaps that are existing right now.
Yeah, that's a really good point. And I think a really good take on the importance of virtual advocacy, right?
Yes.
For folks who maybe are new to rare disease advocacy, can you drill down for a second on, what does it actually mean to advocate virtually? Like, what does it look like? Are you joining a Zoom platform to talk to your legislators? Are you calling their offices? Are you sending them emails? Can you just share a little bit more about what that looks like in today's world?
I did all of the above.
Yeah.
It was coordinating Zoom calls, it was conference calls, it was email, and I sort of feel like we had no choice. So everyone was much more open to doing so. In the past, I offered the conference call or the phone call, but it was more of an initial come to the office or come to the district office, right? So we
Right.
sort of went to that first, but all of the above. And really being able to contact the legislative aides. So gave me an opportunity, gave all of us, right, along with my co-ambassadors, it gave us an opportunity to almost reach more people, talk
Mhm.
to more people, just from a just bigger component that we didn't have to do the drive. And they had the time as well because it's a lot quicker to get off of Zoom and go on another call. So all
Yeah.
of the above.
Yeah, that's a great point. Irfan, what about you?
Yeah, I mean, same as Johanni, right? I mean, we
Yeah.
use Zoom, we use Skype in some cases, we use Teams, right? Whatever was at the disposal of the
Right.
lawmakers, right? So we use all of the above. And then one thing I want to share, the way we use the pandemic to raise more awareness is, as the state of Delaware was rolling out the policy for vaccinations, right? So we kind of used that as an opportunity as well, because in many of the cases, the parents might not fall into that critical category, right? The top priority, but then because of the conditions of their kids, right? So they become, they need to be prioritized. So we use that as an opportunity to raise awareness in the rare disease as well, and that worked to some extent. And some of the rare disease caregivers were categorized as high priority receivers for the vaccinations. So we used all these opportunities, right, to raise awareness.
Yeah, no, that's great. Those are all really good examples of ways to get involved and get through in this virtual environment. And I hope a lot of those stay, right, post-pandemic, because I think it's been really great, as you both pointed out. I mean, due to the nature of states and where capitals are, it's really made this, this advocacy journey more accessible for a lot of people. So it's been really exciting to see, as much as it's been challenging, of course. I'd like to take a step back for a minute now and talk about some of the differences between advocating at the state and federal level. As we talked about earlier, sometimes there's a misconception that, all of the advocacy happens, in Washington, D.C. And while that's really important, I think you both have highlighted the importance of state advocacy. So can you talk a little bit about some of the differences in, through your experience with state and federal advocacy and how you've gone about doing that? Johanni, we can start with you this time.
Yeah, both equally as important. I've had a really great time, of course, visiting in Washington, D.C. with NORD, but also have had a lot of opportunities to meet my elected officials at a federal level and sort of incorporate the two. This is what we're doing in Florida, and this is what needs to be done at a federal level just to have a greater impact, or because it's going to help us in our state. And so I think connecting both of them, right? They're elected officials from our states at a federal level, and connecting the two. And the conversation's a little bit different because we can talk about in those meetings, I've talked more about your constituents, and they're all constituents, but right, we can make it a little bit more personalized at the state level versus the federal level. We can say these number of individuals. So I make it, of course, we use the broader numbers, the bigger figures or numbers or disorders, but I connect the two and say, this is what we're doing. This is the great work that's being done in our state. We want to translate that. We want to be a leader, right? Florida wants to. So can you help us? Can you join the Rare Disease Caucus and sort of talk about the things they can do at the federal level, support this bill and things of that nature?
Yeah, no, those are great examples. Irfan, what about you? What are some of the differences that you've experienced, with advocating at the state versus the federal level?
Yeah. So I would say, in general, the process of engagement is the same, right? I think the only challenge we typically find is in terms of accessibility of the federal lawmakers, right? Because I mean they're so consumed, they're mainly based out of DC. So except that, I think the process of engagement I found was similar. Although I would say the RAN network, right, that typically primarily operates at the state level, right? So RAN typically complements the great work that NORD has already been doing at the federal level. And the only difference that I see is it depends on what kind of advocacy work you're driving, right? For example, if you're working on pushing for medical nutrition coverage through state-sponsored programs, then you are going to be working closely with the state lawmakers, right? And then I would say there is more federated coalition that's out there at the federal level, right? But I think where we can make, as RAN ambassadors, where we can make the huge impact, right, where we can really move the needle is working at the state level. Where a lot of people think that, hey, all this happens at the federal level. Even if the federal, medical nutrition, food equity is a great example, right? Even though there is a mandate at the federal level, the implementation is still left up to the states, right? If you don't drive that right at the state level, it's not going to work, right? So that's where the rubber meets the road, as I would say. So definitely, again, we are lucky in the state of Delaware, right? Because even though we are a small state, we still got 2 senators, right? Compared to California. California is fighting with, to access those 2 senators. So we have a good rapport here. So I have open door policy with both the senators and the one House of Rep that we have, Congresswomen. So we have good access to them. And then obviously, we are also working closely with the state lawmakers.
Yeah, no, thank you both for sharing that. I think those are all great points. And I want to drill down for a second on something that you said, Irfan, which is that, it generally feels the same. Maybe you're meeting with different people, but it still is the same. And I think it's important to note for some of our newer advocates that are joining us today that, a lot of times at the federal level, for example, you may be meeting with the member staff member, but that doesn't mean that, the issue isn't of importance to them. That's just how federal advocacy works. You're meeting with their policy staff who then, go back to their boss, who's the senator or the representative, to share your experience. So it's all really important. And I think it's just, really good to note that there are differences, but at the end of the day, we're all working towards the same goal, right? So thank you both for sharing your experience with advocating at the state and federal level. Now let's talk a little bit more about, what it feels like in the moment to advocate. I think it can be a little bit scary. I remember the first time that I had a meeting with a senator, and it can be a nerve-wracking experience, right? Because you're thinking through what you're going to say and how you're going to get there, and all of the other logistics that come with it. So can you both, talk a little bit about what it was like to advocate for the first time, and any tips that you have, for new advocates? And Johanni, we can start with you.
Yeah, you bring a good point. I remember sort of thinking when I first wanted to do this, and I was asked to be the ambassador, and I had just started. I was really new to this, and so I think some of it is it's okay. I had to get in my mind that I knew enough about my son's condition, and that I didn't have to know it all, that there was other individuals that could help me. That was first, because I sort of was a little nervous about going and saying, well, maybe they know I'm sort of new at this. They don't. Share your story. I shared my story and made it brief, because I understand that the time was going to be of the essence. And so I sort of condensed it for impact. But then, of course, if time permitted, then I was going to share a little bit more. But sort of I had to put myself in this mindset. I can do this. It's okay. I don't have to be an expert. I have to just share my story and say why this is important. What is it that I would like them to do? How it impacts the greater good and other individuals too. The other thing was I remember getting a little frustrated at first when I felt like I wasn't getting anywhere, and or progress wasn't being made. And I had to, I have to think and pause. And even today I have to pause and say, it's okay. It's going to take time. This isn't a race. Because we want to see results as advocates. And,
Right.
Sometimes I think we can get discouraged by that, but don't. Just keep at it. Tell one more person, schedule one more meeting, call someone else, right? And a different person. And it sort of felt for me when I started working, especially like with the RDAC. It's been a couple of years, and they didn't know anything about rare disorders, or they didn't know about the RDAC. And so it was easy to sort of get discouraged as I drove to different offices, but you just keep going. And maybe it isn't the first meeting that they'll get it. Maybe it's at the second or third contact. And if anything, you'll just make really good connections.
Yeah, those are all really great points. I think, drilling down on your point, Johanni, for a second about preparing, right? And how are you going to share your story? Because you get, into a meeting sometimes, and, they may only have 5 minutes. So how do you decide the most important part of your story to share? And that can be really difficult to do, especially when you're new at this. So do you have any tips for, how to prepare to share your story?
Yeah, so I remember, and I will say that one of my first meetings, I was meeting with the senator, so I thought I was meeting with the senator, and it actually turned out that when I got there, it was actually a staff member, and I was a little bit discouraged by that, and I was
Sure.
like, oh, okay, but I still, as I was preparing, I said, if I only have 5 minutes, I'm going to clearly state my name, um, state why I'm there, why I'm there. I had a son. He was diagnosed with a rare disorder. It was a surprise to me, and sort of made it really quick. A surprise to me, sadly, because of the lack of testing and knowledge and awareness. He was diagnosed too late, and he lost his battle. I need your help doing this, because it will impact these number of families. And so I sort of made it like a quick 3 bullet point story, just in case.
Yeah.
And I sort of practiced it a little bit. I went prepared as well, Rose, with just some information on what I was trying to do, because
Mhm.
there's a chance that they won't know what I'm talking about. So thanks to Nord and some of the literature that's out there, right? I had prepared
Mhm.
some bullet points, some things that they could look at, and took a folder nicely prepared with all my contact information to make sure that I left something behind.
Yeah, no, those are all great points. And Irfan, I'm going to turn it over to you in a second to share, your experience and tips for a new advocate. But Johanni, I think you hit the nail on the head there. I mean, I think it's preparing your story, right? And practicing. It can seem really awkward, but practice in front of your mirror or practice with a family member at home, a friend, because the more that you talk through your story, the more comfortable that you'll be in a meeting. And I think your second point about, bringing some leave behind materials is always a great idea. Having a one pager that explains, about your rare disease or your condition, or, even the backgrounder. Nord has a great backgrounder on what a rare disease is. And I think those are all really helpful things to bring into a meeting that, they'll use and will remember after. So thanks for sharing that. What about you, Irfan? How do you prepare for a meeting, and what tips do you have for a new advocate?
Yeah, so I would say Joanne kind of covered it all, right? So I think definitely I want to highlight that it is a personal story, right? I think it's your personal story that makes the connection, right? Because you're approaching your lawmakers and they know, hey, these are my constituents, right? So that
Right.
personal connection is very important. So that's what we do, and that's what we did, and that's how we keep doing it, right? I mean, whenever we meet the new lawmakers, we share a personal story, and then always make sure that they're always hard pressed for time, right? So always have this elevator speech ready, right? You won't get the half an hour to share the whole story. Get that 30-second elevator pitch ready, and then leaving behind the material. So what we did the first time when I went to the state capital to commemorate the Rare Disease Day, this was back in 2015. What I did was, thanks to Nord, we got all those brochures and the materials, and then on top of it, I also had a printout of my personal story, and then I left it on the desk of all the 30 legislatures, right? So I was able to spend good quality time with about 3 or 4, but for the rest 25, 26 of them, they had the materials, the Nord material, as well as my personal story of my kids journey, right, as part of the printout. And then you'll be surprised, almost 10 to 12 of their staff members, they contacted me saying that we would like to know more about it and how we can work together. So it's very powerful. Be prepared, get that elevator speech ready, and then like Joanne said, right, first time you don't get you're not able to break the ice, don't worry about it, right? I mean, this is a journey, right? Like you say, like this is a journey. So second time you'll break the ice, or the third time, but you will break the ice.
That's great. Thank you guys both for sharing that. I mean, I think that's great. Well, you definitely will get through, and rare disease advocacy, like all advocacy, it takes time. And, making policy and creating laws does not happen overnight, right? So we have to keep working together, and we have to keep working at it. And, it's one meeting after another, like you guys have talked about, and just raising awareness for what a rare disease is, and why why a certain policy may impact our community more over another. So thank you all for sharing that. What is one common fear that you had before going into your first meeting? Because I think there's a lot of misconceptions out there too about, like, what does a meeting look like with a legislator? So what was one fear or thing that you were nervous about before going into your first advocacy meeting?
I will say, it goes back, there's sort of two. One for me was that I was going to be asked something that I didn't have an answer for at the moment. I sort of felt like maybe I need to have numbers and data. And that was my big fear, is that they're going to ask me something. How many, of these how many of these individuals are in the state? And so I was not going to have it. That was one. And the other one was, honestly, it was fear of rejection, like just completely being told, I'm comfortable with no's. But when you're advocating, and it's really emotional because it is our personal story. I was sort of thinking about, what if they just don't want to hear my story? And it sort of made me a little bit sad in a sense, but it doesn't work that way. They want to hear your story, but those were my two, that I was going to be asked something that I wasn't going to have an answer for. And I felt like I needed to have it then and there. You don't. I've learned that. And that they were not going to want to listen to me and my story. And they do. So
Yeah. Yeah, no, those are those are great points. I think I can relate to the data piece, right? And I think it's okay and that to say no, right? That you don't have the answer to something and that you'll get back to them, you know. And I think that's a really important skill to learn. So thanks for highlighting that because I think that can definitely be scary going into your first meeting. Irfan, what about you? Any anything in particular that you were really nervous about as you were preparing for your first legislator meeting?
Again, I think the one concern I had was, am I prepared enough, right? So like Johanni
Right.
mentioned, right? So that's where I think I would really say that the nod literature kind of came handy because I think many data points with, and not specific to I mean MMA per se, right? But a lot
Mhm.
of other data points were there that really helpful. So that was my one fear in my first meeting, and the second fear I had was I was like, will this lead to something, right? I mean,
Right.
what will this lead to any kind of call to action? Will this meeting be result oriented or not, right? So that's what those are two concerns I had. But like I said, for the second concern, right? In the first meeting, I mean, we did break some ground, but then it took us two or three subsequent follow-ups to get there.
Yeah, no, that's great. I think the message is clear. We have to keep working, right? And keep at those meetings and keep sharing our stories. So thank you guys so much. We're running out of time here, but I wanted to turn it over to you guys for a second to leave our audience with some closing thoughts here. Based on your experience, with rare disease advocacy, what is one thing that you'd like to share with our audience who's joining us today?
I mean, I would say it's a journey, so don't get disheartened if you don't achieve the pursued success, right, in the first attempt. And then the second thing is it's all about building a collaborative network of rare disease advocates, right? As we say, alone we are rare, together we are strong. Remember, our goal is to build a coalition, and then raise awareness, right, of rare conditions, and then uh, through the synergy of this coalition of advocates, you need to call to act, right? So networking, awareness, and call to action.
Those are great. Johanni, what about you? What are some closing thoughts you want to leave our audience with today?
I think your friend, you took it, you hit it right in the head, in that we need to keep doing it, right? And so if anything, I would say share your story, connect, share with one more person each time. So think about that. Who can I share with today? Because through that, I think we create these ripples that we are educating and we are raising awareness and we're building our network. And right, and those things lead to growing the awareness, growing the network, and then being able to do this take action together. So don't be afraid, and the more you share, the better you're going to feel, more comfortable you're going to feel, and the more I think clarity you'll also have as you share, whether it's legislators, whether it's your neighbor, your coworker. Um, Everybody can help us, right, in this journey that we're on.